morning, my professors and colleagues. It's my honor today to present my topic entitled The Added Value of Ultrasound Elastography in Diagnosis of Focal Hepatic Lesions. As we know, focal hepatic lesions constitute a daily challenge in our practice, and usually we start with ultrasound as a primary imaging modality for detection of these lesions. However, we follow this ultrasound by triphasic study, CT or MRI, for better characterization of these lesions according to the enhancement dynamics. Conventional imaging techniques cannot provide information about tissue mechanical properties. And in order to increase the sensitivity and the specificity of ultrasound elastography has been emerged. Ultrasound elastography is an imaging technique that displays the tissue stiffness. Sonoelastography is based on how a tissue deforms when a force is applied to it. Elasticity is defined as the ratio of tension needed to produce a relative change in length. And hepatic focal lesions are different in their tissue composition and consequently in the degree of stiffness. Tissue injury, whatever the cause, tumor or fibrosis, will change the tissue stiffness. And as a general rule, most of benign lesions are soft and malignant lesions are hard. However, there are some exceptions. This table summarizes the different techniques of ultrasound elastography. For example, transient elastography, fibroscan, which is used for assessment of degree of fibrosis, acoustic radiation force impulse, and shear wave elastography. How to measure the degree of stiffness, either qualitatively or quantitatively. Qualitatively, by the color map, red, green, and blue, and quantitatively, it's a semi-quantitative technique in strain ratio, and quantitatively by measuring the kilopascal. The aim of this study was to assess the role of one of the stiffness-based imaging, which is ultrasound elastography, in differentiating focal hepatic lesions. The current study included 104 patients who were referred to radiology department at Alexandria Main University Hospital, and all patients were subjected to grayscale ultrasound elastography using ESRNM Lab 16, triphasic CT and or MRI for characterization of these lesions, and histopathological examination in indicated cases. The current study included 45 males with mean age 47 years. The mean strain ratio among benign lesion was 1.08, and among malignant lesions was 4.14, with statistically significant difference between benign and malignant lesions. This table summarizes the final pathological diagnosis of our cases, including malignant lesions, cholangiocarcinoma, hepatoblastoma, hepatocellular carcinoma, and metastasis, with high strain ratio, and the high strain ratio was in cases of cholangiocarcinoma due to its content of, or high content of fibrous tissues. Benign lesions including focal nodular hyperplasia, adenoma, and hemangioma with low strain ratio. This walk curve showing the cutoff value of strain ratio more than 1.7 of high sensitivity specificity, positive and negative predictive value for diagnosis of malignant lesion. And now I'll go through some of our cases. This is grayscale ultrasound showing cirrhotic liver with well-defined focal hepatic lesion. By the color map, the lesion is blue and green in color. According to this scale, blue and green is hard, red and yellow is soft. The strain ratio is equal 2, and this case was diagnosed as HSC. Another case of HSC showing a rather well-defined mass lesion. Again, by the color map, it's hard inconsistency, high strain ratio reaching 2.3. This HSC lesion heterogeneous, but again, it's a hard component, blue and green, with high strain ratio 3.6. Another patient with well-defined large mass lesion, heterogeneous in its component. The hard component, which is blue and green, of high strain ratio reaching to 5, and this case pathologically diagnosed as cholangiocarcinoma. Another case of cholangiocarcinoma, and again, cholangiocarcinoma characterized by the presence of high fibrous component. So it's strain ratio will be high and easily to be diagnosed by ultrasound elastography. 12 years old girl with sizable mass lesion, hard inconsistency with strain ratio up to 4, and this is diagnosed as hepatoblastoma after surgical excision. A known patient with colon cancer, and by ultrasound there is a well-defined focal hepatic lesion. By color map, the lesion is blue, again, according to this scale. Blue is hard, and high strain ratio reaching 3, and this case was diagnosed as solitary hepatic metastasis from colon cancer. As we know, colon cancer usually containing the primary tumor containing fibrous tissues. So the metastasis also will contain fibrous tissues, and the lesion is hard. A rather well-defined hyperechoic lesion on top of non-cirrhotic liver. By the color maps, the lesion is more or less the same color of the normal liver parenchyma and of low strain ratio, 0.9, and this case was diagnosed by triphasic MRI as adenoma, hepatic adenoma. Another patient with well-defined hyperechoic lesion. The color maps the lesion is the same color of the surrounding normal liver parenchyma with low strain ratio 0.6, and this case was diagnosed as hepatic hemangioma. So in conclusion, ultrasound elastography is a promising non-invasive non-contrast technique which can be added in the routine, to the routine grayscale ultrasound examination for better detection, characterization of these lesions, and we should take in consideration heterogeneity of the lesions, benign lesions with fibrosis and malignant lesions with necrosis, which will change the degree of stiffness to avoid false positive and false negative results. Thank you.